Hello, it's your Pikin-doctor. So today what I want us to talk about is a very important topic to parents, and it's called birth asphyxia. Have you heard of it before? Yeah, I guess you must have heard of it. So today I'm here to throw some little lights to that topic, so just pay attention and listen attentively. This might help you, this might help somebody you know. So what is birth asphyxia? Birth asphyxia is when a baby does not initiate spontaneous respiration at birth. So in a layman's term, when baby no cry when they born am, the pikin no dey active when they born am, we need to do one or two things to make sure say the pikin they wake up, they active, cry, move. Do you understand? So there are a lot of causes of birth asphyxia. It can be maybe due to the baby or due to the mother, or when it happens inside during the delivery or even after the delivery. I will not bother you with all those things. I'm just here to tell you things you can do to prevent that birth asphyxia, for it not to happen to your baby. Because if your baby did not cry well at birth, or there's any reason that happened, your baby came out, no breathing, we have to breathe for your baby, no cry, we have to make your baby cry, it used to affect the brain. You get the point now? And if it affects the brain of the child, mommy, daddy, I don't wish it on any child. But the unfortunate thing is that we have a lot of asphyxiated children in our neurology clinic. A lot of them have what they call cerebral palsy. It means their brain growth was arrested. You see them, you people popularly call them imbecile, but they are not imbecile, they are special children. Some of them come down with seizure disorder, which they call convulsion problem in the way you understand it. Some come down with mental retardation. That means they are not smart. Their IQ is a bit reduced. They can't do things other children can do very well. Do you understand? So a lot of them have some developmental problems, that will not, I don't have the time to talk about all of it in this video, but I'm just here to tell you that birth asphyxia have a lot of impact on the child. Not just the child, the parents, the caregiver of that child, and the society at large. This awareness I'm trying to create is to reduce the incidence of birth asphyxia. A lot of parents need to be aware of the risk factors we have that are available out there that contribute to the number of asphyxiated children we have. But there are some that you, the pregnant woman, the parents of that child, can control. So that's what I'm here to enlighten. There are some that we, the health workers, have to do. There are some that even the government have to do to equip the facility in order to reduce the incidence of this birth asphyxia. But I'm here to tell you the one you mommy need to do. Please and please, if you're pregnant, try and register in a health facility. I don't mean Mama Nkechi's place. I don't mean Papa Nkechi place, or that person you call doctor and nurse in your village. It might shock you that they never went to any school or to become any doctor or nurse. To shock you. So please go to a hospital. It can be a health center in your village, in your community, wherever you find yourself. Make sure that you register in a hospital, and make sure that a doctor, a real doctor, is seeing you when you're pregnant to check you and check your baby. There are a lot of things they need to check: your BP, your sugar, your urine, your blood group, your genotype. They need to check all those things to be sure that it's okay when you're pregnant, because it's not only the baby that is at risk, so you, the pregnant woman, is also at risk. You understand? So they need to check you. And apart from checking you, being the mother, they need to also check and monitor the baby, if the baby is developing well inside the womb or not. So that is part of the supervision that doctors do when a woman is pregnant. Now, if the pregnancy is complicated, that doctor that is supervising you in a health center or maybe in a private hospital will refer you to a tertiary center where the specialist will be the one to handle you. And please, during close to when you want to deliver, run away from any health facilities that don't have resuscitation equipment, things they use to resuscitate a baby, things like oxygen, ambu bag, a trained health personnel that can do resuscitation. Run away from that facility, because if your baby or unfortunately does not cry well at birth or does not breathe, they don't have those facilities to make your baby start breathing or start crying, and that will your baby's brain development. So please take this very serious. If you're pregnant or have a pregnant relative, advise them to go to a hospital to see a doctor that will supervise their pregnancy. Advise them to deliver their child in a hospital to reduce the incident of birth asphyxia. In a hospital, there are trained personnel that are trained to resuscitate a baby, then they will help resuscitate your child. And if that child is asphyxiated, we'll have treatment protocols we put in place to reduce the impact of the asphyxia on the brain, so that your babies might not end up to be those children you describe as imbecile or mentally retarded or having conversion problem or not doing well in school. So this tip is to help you, and because I'm here to help you, what you need to do is what? Like my video, comment, share, and follow me, so that you'll be getting important tips like this. Don't say I did not help you. Don't say I did not help you. 2026 is coming. If you're pregnant, start going to that health center in your place now. Stand up now and start moving to that health center in your place and go and see a doctor. Stop going to Mama Nkechi's place to be massaging your belly. Tomorrow you come to clinic and come and tell me that your child is taking 25th out of 26 children in a class. You start complaining that your child have not worked at 3 years. You start complaining that your child is still peeing on the bed. Please take this advice very serious to prevent all these complications I talked about. It's your favorite Pikin doctor. I'll see you in my next video.